Okay, students, am I audible?
Yes, ma'am.
Thank you. So, first, intellectual disability means earlier it was called as mental retardation. Now it is termed as intellectual disability, and it is a developmental disorder. Person with intellectual disability have more difficulty than others in similar age group in learning new things, understanding concepts, and solving problems, and remembering, etc. And they have low average intellectual capabilities, and also they have limitations in daily life activities such as self-care, work, health, and safety. And consequently, they need extra support to learn and live. And this term intellectual disability was recently introduced due to the negative connotations and stigmatizations attached to the term mental retardation. And now it is calling it as an intellectual disability. And this intellectual disability is an equivalent of intellectual developmental disorder, which was adopted in the International Classification of Diseases, that is ICD-11. Now we are using the ICD-11 of the World Health Organization. The term MR refers to the significantly sub-average general intellectual functioning, resulting in or associated with concurrent impairment in adaptive behavior and manifested during the developmental period. And this DSM-5 defines intellectual disability as a neurodevelopmental disorder that begin in childhood and are characterized by intellectual difficulties as well as the difficulties in conceptual, social, and practical areas of living. So the significant limitations are like intellectual functioning. But first we are going to discuss about the intellectual functioning and adaptive behavior and onset. So these kind of children will be having the IQ below range of 70. So this refers, intellectual functioning refers to the personal ability to learn, reason, problem solving, and comprehend abstract concepts. And intellectual functioning is typically measured by IQ test, with scores below 70 indicating significant limitations. And adaptive functioning encompasses the skills necessary for daily living, including communication, self-care, social interaction, and independent living. And these children will have difficulties in adaptive behavior, significantly affect an individual's ability to function in daily life. And onset is from it manifests during the developmental period, typically before the age of 18. And it is not a condition acquired later in life due to injury or disease. So it will develop before the age of 18 years. And the definition is like the characteristics are like both symptoms emphasizes deficits in intellectual functioning and adaptive functioning. Deficits in intellectual functioning includes reasoning, problem solving, academic learning, judgment, etc. And the adaptive functioning deficits cover conceptual, social, and practical domains such as language development, social skills, personal care, and employment. And understanding these severity level and associated deficits help in providing tailored support and intervention to individuals with intellectual disabilities, promoting their optimal personal functioning and quality of life. And these IQ ranges, mild IQ is from mild intellectual disability. IQ ranges between 51 to 70, and moderate is between 36 to 50, and severe is between 21 to 35, and profound level is in bit, which is less than 20. In the world population, we are having mild 85% of with mental retardation, and moderate 10%, and severe 4%, and profound 1 to 2%. And in India, 2% of population in thousands. And the causes of ID, which includes prenatal, perinatal, postnatal, and environmental causes. And these prenatal causes also include genetical causes and birth hazards. The common prenatal causes, such as a very young mother under the age of 18 and over age 35. Mother, if he is having under age 18 and over age 35, maybe chances of having a child with intellectual disability. And this next one is the radiation from X-rays. If she is exposing to radiation or X-rays, maybe a chances are having a child like that. And experience of intense fear, if she is having an intense fear, anxieties, and other emotions of mother can affect the child in more severe ways. And threatened abortions, third trimester hemorrhage, and maternal diseases such as diabetes mellitus, epilepsy, jaundice, tuberculosis, high blood pressure, chronic problems in the kidneys, and malnutrition. If the mother is having all these symptoms like high blood pressure, chronic illness in kidneys, and malnutrition, may be a chance of having. And thyroid dysfunction of mother can damage the growing fetus. Drug use for various reasons, if she's using any drugs for various reasons, maternal infections, RH incompatibility, and use of alcohol and smoking during pregnancy, and genetic and chromosomal abnormalities also causes. And here, fetal alcohol syndrome is also a cause for having a child with intellectual disability. It is caused by the mother's heavy drinking during the first 12 weeks of pregnancy. Some studies have shown that even moderate alcohol use during pregnancy may cause learning disability in children. And drug abuse and cigarette smoking during pregnancy have also been linked to mental retardation. We have covered now the prenatal causes, and now we are moving to the perinatal causes. Prenatal cause means during conception, and perinatal cause means during delivery period. Premature birth, like premature birth, post-term birth, low birth weight, respiratory distress, prolonged labor, if the mother is having prolonged labor or delivery by improper use of instruments, abnormal position of the fetus in the uterus, and excessive coiling of umbilical cord around the neck of the child or the fetus, what we call. The abnormal position of the placenta, toxemia of pregnancy with high blood pressure, and fits in the mother during delivery period, and hemorrhages in the brain, severe jaundice, medicines administered to the mother, and multiple births. If she is having like twins, maybe a chance of having mental retardation in the child. Now we are moving to the postnatal causes. That is after delivery to 5 years of age. The causes are like malnutrition in the child, infection in the child such as meningitis or encephalitis, and seizures in the child, mercury poisoning, any injury to the brain from accidents or falls may also cause MR. Now we are covered pre, peri, and postnatal causes. And now we are going to know about the environmental risk, which includes the condition associated with poverty, the risk of adolescent parenting, the impact of prenatal illicit drugs or alcohol exposure, and concern related to parental mental health conditions, family instability, And child abuse and neglect are among the risk factors that increasingly challenge a child development. So we have covered almost all the points, the causes, what is the definition of mental retardation, okay? And this, if the child is if the child is diagnosed as mild mental retardation, the individuals with mild mental retardation typically have intellectual disability within the range of 50 to 70. So that kind of child, we are diagnosing the child as a mild MR, and they can often learn practical life skills and may be capable of semi-independent living in appropriate support. And if the child is diagnosed as moderate ID, intellectual disability, and having an IQ of 35 to 49, those with moderate intellectual disability have more significant limitations in intellectual functioning. Like they may learn basic literacy and numeracy skills, but typically require significant support for daily living tasks. So they may study up to 10th with the help of the parents and teachers and siblings. And they are educable, means they can train. If the special teachers train the child in special schools, they can learn the things in a better way. And the third condition is a severe. The child is diagnosed with severe ID, and the IQ ranges is from 20 to 34. Individuals with severe intellectual disability have very limited intellectual functioning and often require extensive support for daily activities and personal care. And they may learn some basic communication skills, but typically require supervision and assistance throughout the life. Okay. And last one is a profound diagnosis. Children with profound mental retardation. The IQ, which is less than 20, and this disability is a most severe level characterized by extremely limited intellectual functioning. Individuals at this level often have significant typical and sensory impairment as well, requiring constant care and supervision. Okay. Now we are moving to the next lesson, which is Unit 12, Substance-Induced Disorder. So different substances, if the individual is using, so what are the causes, what are the problems, and how to treat them, we are going to learn in this lesson. So the people use a lot of different things for food and drinks. Something we try just out of curiosity, some substances not only give us energy or make us feel better physically, but they can also change our mood or how our brain works. For example, we might take aspirin for a headache, antibiotics for an infection, or a tranquilizer to calm down. We might drink coffee to wake up in the morning, or have wine to relax with friends. Some people smoke cigarettes to help them feel less stressed. So the substance-related disorders encompasses a range of conditions characterized by the problematic use of substances, such as alcohol, opioids, stimulants, hallucinogens, and other psychoactive substances. And the Diagnostic and Statistical Manual of Mental Disorders, that is DSM-5, provides criteria for diagnosing substance-related disorders, and including substance use disorders and substance-induced disorders also. And the classification of substance-related disorders, the change in the 5th edition of the Diagnostic and Statistical Manual concerning substance-related disorders represent a significant shift in how mental health professionals diagnose and conceptualize issues related to the substance use. The key changes and categories such as terminology shift, definition of dependence and tolerance of withdrawal. So first we will move to terminology shifts, which means that DSM-4 removes the term abuse and dependence and replaces them with an unified concept of substance use disorder. This shift aims to provide a more comprehensive understanding of substance-related issues without stigmatizing individuals. And the second point is definition of dependence. So what is dependence means? Dependence is divided into two forms, that is physical and psychological. Physical dependence refers to the withdrawal symptoms when substance use is abruptly stopped or reduced, while psychological dependence involves craving, loss of control, and continued use deposit negative consequences. And the tolerance and withdrawal means needing higher doses of the substance to achieve the same effect, while withdrawal involves symptoms occurring when substances use is reduced or stopped after prolonged heavy use. And the substance use disorders means it is diagnosed based on the pattern of behaviors related to substance use, categorized into impaired control. They're not having any control for using the substance, and social impairment, risky use, and pharmacological criteria. And diagnosis requires meeting at least 2 of the 11 criteria during a 11 months period. And if the individual is having severe levels means substance use disorders are classified as mild, moderate, or severe based on the number of symptoms met during the test administration. And categories of substances. DSM-5 outlines 10 categories of substances, including alcohol, cannabis, caffeine, hallucinogens, inhalants, opioids, sedatives, hypnotics and toxic stimulants, tobacco, and others, or unknown substances, which gives kick to the individuals after having the substance. And substance-related categories means the categories include substance use disorder, substance intoxication, and substance withdrawal, each with specific diagnostic criteria. And intoxications and substance medications-induced mental disorders refers to an acute symptom resulting from recent abuse use, while substance medication-induced mental disorders include various mental health problems that develop as a result of substance use. Overall, these changes aim to provide a more comprehensive understanding of substance-related issues and emphasizing a spectrum of severity and addressing each substance separately with consistent diagnostic criteria. So if we want to know about the substance abuse disorders, first we have to go through all these terminologies like terminology shift, definition, what do you mean? What is meant by dependence, tolerance and withdrawal, substance use disorder, and the severity levels where he is falling, the patient where he is falling during the diagnosis, and categories of substances. You should know about the DSM-5 and ICD-10, criteria and substance-related categories where they are falling in that DSM-4, DSM-5, and as well ICD-10. And intoxication and substance medication induced mental disorders. And you should be knowing about all this terminology for diagnosing the case of substance abuse. So first we'll move to the alcoholism. Definition of addiction. Addiction is described as repeated involvement with a substance or activity, despite the harm is caused due to the pleasure or value it provides. Global alcohol consumption means more than 2 billion people worldwide consume alcohol, with approximately 16% of drinkers engaging in heavy episodic drinking, termed as binge drinking. And the effects of this alcohol use affects the central nerve. It affects after consuming the alcohol, it affects the central nervous system of human beings, and initially leading to relaxation, but later impairing judgment, coordination, and motor skills. So they will be impaired in all these areas, and excessive alcohol consumption can result in emotional volatility. It means the characteristics of changing the emotion often and unpredictably. It means if the person is laughing, suddenly he'll change to crying. That is the immediate effect, which is the cause of consuming alcohol. And impaired vision and hearing, and difficulties in tasks such as driving. After having the alcohol, if the person drives, may lead to accidents. So first we'll move to the alcoholism and alcohol use disorders. It often interchangeable with alcohol use disorders characterized by impaired control over alcohol consumption due to physiological dependence. The disease moral views alcoholism as a chronic condition, while some professionals argue that some individuals can learn controlled drinking behaviors. And personal and social costs are like alcoholism incurs significant personal and societal costs, including lower productivity, joblessness, socio-economic decline, and involvement in violent crimes, alcohol-related incidents contributing to a substantial proportion of suicides. And risk factors for alcoholism, factors such as gender, men being more susceptible, age, typically developing in young adulthood, and antisocial personality disorder, and family history and socio-demographic factors contributing to an increased risk of developing alcoholism. If the family history is more, if the father is drinking in the house, maybe the child looks like modeling. So whatever he is experiencing by observing or perceiving his father, maybe it may leads to the child may drink alcohol after observing his father in the family. And coming to the drug addiction, throughout history, people have used different substances to change how they feel or deal with stress. And these could be things like alcohol, herbs, and prescription drugs. Sometimes using these substances can lead to a problem called addiction. This means a person becomes really dependent on the substance and can't stop using it, even if it's causing them harm. So first it will become a hobby, then he'll depend on the substance. So he can't stop using it. Even though if he is getting harm physically, like biological causes also, if it is affecting, he is not going to stop for using the substances. And the addiction usually doesn't happen at all at once. It often starts with using the substance casually, maybe relaxed or often fun with friends. But over time, the person might need more and more of the substance to get the same feeling. And they might start using it even when it's causing problem in their life. And addiction is taught to deal with, but it's important to understand that it's a medical issue, not just a lack of willpower. And there are ways to get help like therapy or support group to overcome addiction and live a healthier life. So first, he should have a behavior to change. He should think that he has to change. If the if the thinking process is like that, there is more improvement in therapy, for going a therapy and taking the support of other people, and if and using the medication also for stopping the substance. And the consequences of drug abuse can be devastating, affecting not only the individual but also their loved ones and society as a whole. Here's a breakdown of some of the consequences mentioned and additional ones, and they are legal and criminal consequences, are like engaging in illegal activities to obtain drugs, such as pursuing illegal substances or forging prescriptions, can lead to legal actions, including fines, imprisonment, and a criminal record. And the social and relationship impact. Drug abuse can strain relationship with family, friends, and colleagues. The individual may become isolated or estranged from loved ones due to their behavior while under the influence or their inability to maintain healthy relationships. If he's having substance or alcohol, consuming the alcohol, so he should be isolated from the family. Nobody wants to live with him because of this behavior. And financial strain. Sustaining a drug addiction can be financially drained. Individuals may spend significant amount of money to feed their addiction, leading to financial instability, debts, and even bankrupt can be caused. And even occupational consequences also will affect. Addiction can impair one's ability to perform at work and maintain steady employment. This can result in jobless, reduced earning potential, and diminished career prospects. And even these kind of individuals are having the health risks also. The physical and mental health consequences of drug abuse can be severe and long lasting. These may include overdose, organ damage, infectious diseases. Infectious disease also may be caused, such as HIV, AIDS, or hepatitis from needle sharing, and malnutrition, and mental health disorders like depression and anxiety. And the risk factors of accidents and injuries. Operating vehicles after using the substances or machinery under the influence of drug significantly increase the risk of accident and injury, not only to the individual, but also to innocent, those who are staying behind them. And risk of violence. In some cases, drug abuse can lead to aggressive or violent behavior, and both the individuals and those others around him can affect. and risk of overdose and death. Drug overdose is a significant risk of individuals abusing substances. The potency and unpredictability of illicit drugs can lead to accidental overdose, resulting in coma, brain damage, or even cause death to the individual. And the psychological impact is like drug abuse can exacerbate or contribute to the development of the mental health disorders such as addiction, depression, psychosis, and cognitive impairment. These kind of disorders also are possible if the person is if the person is taking the substances. And impact on future opportunities. It will impact the future opportunities also. A history of drug abuse and addict can limit future opportunities such as educational attainment, employment prospects, and overall quality of life will affect by using these substances. These consequences underscores the importance of prevention, intervention, and access to effective treatment and support services for individuals struggling with drug abuse. And the causes are like for taking this substance, genetic factors. Some individuals may be predisposed to substance use disorders due to the genetic factors influencing metabolism, reward pathway, and susceptibility to addictions. And environmental factors like exposure to substance use within the family or peer group, if the peer group and within the family are using, and socioeconomic factors and availability of the substances can influence the development of substance-related disorders. And the psychological factors include co-occurring of mental disorders, trauma, stress, and maladaptive coping mechanisms can contribute to substance abuse. And other factor is social and cultural factors. Cultural attitude towards the substance use, societal norms and stresses related to the employment, relationship, or societal pressure can contribute to the substance use disorders. So physical factors, psychological factors, environmental factors, genetic factors are contributing to the substance disorders. And the treatment, coming to the treatment, the various components of treatment for substance abuse disorders play a crucial role in the supporting individuals through their recovery journey. So treatment is very essential if the individual is having severe substance disorder. First, they'll do the detoxification. In drug de-addiction center, if the patient is going for treatment, the first the detoxification. This is the initial phase where the body is rid of the substance. It's essential for managing the physical symptoms of withdrawal, safety, and typically occurs under medical supervision. So it is done with an professional and doctors, professionals and doctors. And the second point in the treatment process is medication. This can be used to help reduce craving or counter the effect of substance use. They may also address co-occurring mental health disorders such as anxiety or depression, which often accompany substance use. So some of the medications are there in the society nowadays. So the individual, those who are taking the substances, they can reduce by taking the medicines, by taking the medicines, they can reduce their behavior of taking the substance. And the third point is motivational interviewing. This is a counseling approach, helps individuals resolve their ambivalence about treatment and find the motivation to change. First, the individual should have the intent to change. And it focuses on building intrinsic motivation and commitment to recovery. So he should be motivated to change his behavior for taking the substances. And the next point is the cognitive behavior therapy. This therapy helps individuals identify and change negative thought patterns and behaviors related to the substance use. It equips them with coping strategies to handle triggers and craving effectively. So therapy explains to the individuals with the substance physically, mentally, and psychologically and environmentally. These are the causes they will explain in detail. What are the causes? Why is becoming like that? They will explain in detail for changing their thought patterns. And group therapy and peer support also is very essential. These programs provide a supportive environment where individuals can share their experiences, learn from others, and receive encouragement. Peer support is invaluable for maintaining long-term recovery and preventing relapse. So, most of us will learn from our friends and relatives, even in school and colleges also. So here, this techniques is also taken in the counseling part, group therapy and peer support, which means how they are overcoming the problem of substance substance use. So for overcoming the problem. And the next one is they'll take the family environment conducive to recovery. So family health, time is. Sorry for the inconvenience. And so we are talking about the family therapy. So family members are very essential part in recovering the patient with substance disorders. So mostly spouse will play a crucial role uh, for crucial role in the family uh, to overcome these kind of problems. And the next one is the life skill training. This aspect of treatment focuses on teaching practical skills that support independent living and employment. And it helps individuals rebuild their lives and reintegrate into the society after overcoming substance use. So there is an essential training is given in the drug de-addiction center. Like first they'll give the life skills training, how to overcome the problems, and treatment focuses on the teaching practical skills that support independent living and employment. So uh, the patient will give the life skills training with the different practical skills and employment also they will provide to rebuild their lives and reintegrate into the society after overcoming the substance abuse. And a comprehensive treatment program often incorporates a combination of these components tailored to the individual's specific needs and circumstances. And regular monitoring and adjustment of the treatment plan are crucial to ensure ongoing progress and address any new challenge that may arise during the recovery process. Thank you. So we are moving to the other session, which is recovery program. Sure. Am I, am I audible?
Yes, ma'am.
Okay. So after taking the treatment from the drug de-addiction center, so recovery from addiction, how to recover up to a certain time, the patient may not take the substances, but after some time again, they may be having the cravings for taking the substance. So for this, we'll see how it is affecting the individual and what are the treatment plans for this addiction. The recovery process, abstinence from addictive drugs, plus conscious effort to making positive lifestyle changes. It is very essential. Recovery can be from physical, psychological, learning to cope with the drugs craving and social pressures, finding new ways of responding to emotional stress and physical strain, getting integrated into a new social network, and learning to find pleasure in drug-free activities, and developing a new way of life, and making qualitative progress in terms of physical health, psychological well-being, work performance, family relationships, financial management. So all these aspects he has to plan to overcome the addiction. And value-based lifestyle he has to maintain. And the 3 stages of recovery, which includes commitment and motivation. He has to prepare for that, and implementation of the specific behavioral change, cessation, and maintenance of behavioral change is most important. And recovery plans at 3 levels, or like recovery is a process of change in terms of restructuring thinking patterns, managing feeling appropriately, and implementing change in behavior pattern. Restructuring, we'll understand what is restructuring the thinking patterns. Reminding oneself on a daily basis of the pain and damage caused by the addiction, and recollecting two good things that happened due to the sobriety on the daily basis. So what are the two things he achieved after taking the treatment? And repeating motivational statement aloud. He has to loudly say to himself to change his behavior for not using the substances. And reinforcing the positive thought that millions have given up drugs. I too can do. That is a most uh, motivational statement he should say loudly to himself. So much, I too can change myself. And managing feelings appropriately. Avoiding loneliness and getting active, and overcoming loss and grief by open sharing. Any problems if he is having, he can discuss with the counselor or a family member or with close ones or friends. He can share, and after sharing, he may get the uh, problem solving situations, problem solving strategies. And handling guilt feeling by making amends, and managing anger through appropriate communication, and overcoming fear through planning one day at a time. I can surely change my behavior. He has to think in a positive way. And implementing behavioral changes are like avoiding people and places associated with addiction. If he's meeting previously, if he's meeting the friends group and having the drugs, that kind of friends he has to avoid. And remembering the HALT principle: hunger, anger, loneliness, and tiredness. And handling craving by postponing the first drink or drug, eating something if he's craving in that situation, and calling a therapist, sponsor, or a friend for support. If he is unable to manage, he can call to his therapist and friend for support. And implementing behavioral changes, leading a structured lifestyle, leading the changing his lifestyle, spending the time with his children and family, living one day at a time, reciting the serenity prayer, he has to pray, and developing new interests. And implementing behavioral changes are like getting into new social network, identifying healthy methods of having fun. He may go to other places like church, temples, and gardens so that he can spend some of the time there and change his behavior of craving, and maintaining regular follow-up with the treatment center and self-help groups. And there should be a follow-up, should be there. Otherwise, he may not cope up with the substance abuse. So he should follow and adhere to the treatment. And learning assertive skills to resist invitation to try alcohol or drugs. And implementing behavior changes continues like regular intake of deterrent drugs to safeguard sobriety, and reviewing relapse prevention strategies periodically. So what are the strategies he should remember regularly? and availing a sponsor, and how can significant others be supportive if an individual is suffering with a substance disorder, modeling the desired behavior, and creating a creating a supportive interpersonal environment, and helping the addict to avoid or cope with the stresses, and significant others, like helping him to overcome a specific temptation to lapse, and providing encouragement for individual for overcoming the addiction process. So the family members should encourage that person to overcome that problem, and monitoring his behavior and helping him to identify relapse cues, and guidelines for counselors understanding the relapse. Abstinence is the ultimate goal, not controlled use. Accept relapse as a part of the disease, and take initiative to contact the patient, and make use of this occasion to help him understand his relapse symptoms and what are the symptoms again he is getting. And the other points are like client to be helped to recognize that temporary lapses are likely not a permission for occasional drug use, and taught skills for anticipating, avoiding, and coping with high-risk situation. These are the guidelines for counselors. Those are treating with the individuals with substance-related disorders, and taught constructive responses to cope with lapses when they occur. If the individual treatment, he stopped drinking alcohol or taking the substances occasionally, and if he starts again, what are the steps he has to undergo, and factors that complicate recovery. What are the factors that complicate recovery? Dual diagnosis. For example, dual diagnosis, referral to a psychiatrist and prescribing drugs. This is a complication. And cognitive impairment, simplify and repeat messages, and lack of family support. Create other support systems for the patient. So dual diagnosis is also a complication. Cognitive impairment is also a complication, and lack of family support. So all these are the complications for recovery. Core functions of the counselors are like psychological assessment, assessing related psychiatric problems, and medical care, addressing physical problems associated with addiction, and informational sessions, providing information on relapse and recovery. So I should think about, I must learn about the process of relapse. Should be having that motivation to change his behavior. Individual counseling is very essential for the individual, those who are having the problem of substance abuse, and group therapy. The patient can learn more from the group therapy. And family counseling, involving family in order to create support during the recovery. Family counseling is very essential. And life skills training is very important. And offering the individuals vocational services like vocational assessment, counseling, referral and skill training is important during the recovery process. And recreational services, providing exposure to self-help groups, and model relapse prevention program, which is like 7 days inpatient or outpatient, 3 days for detoxification, 4 days for psychological therapy, and educative sessions on relapse process, dry drunk symptoms, method to stay sober, and improving life functioning, group therapy, and individual counseling. Thank you for patient listening. So now we are covered all the portions related to the abdominal psychology, which is in UG, fourth semester, second year. So from 26th to 31st of May, we have covered all the 12 units. Okay, students? Yeah, it is open for the discussion. So today we have learned about the intellectual disability and substance abuse disorders. Thank you. Thank you for patience listening.